there is no reason, none, why we as a society should give the ability to the federal government to be making medical decisions for you and your family at all.
That was last night. That was Atlanta, Georgia. Congressman Tom Price at a town hall in his home district. And Price has been a vocal critic of the president's health care reform plan. He says the White House and Democrats in Congress have been dishonest about their plans. A statement from yesterday asking the president to, quote, rein in Speaker Pelosi and the Democratic leadership and begin to correct the gross amount of misinformation that is spewed from both himself and his allies. And that was just the beginning of that statement. From Atlanta, the congressman's with me now. And, sir, good morning to you. Tom Price from the ATL.
Hey, Bill. Great to be with you.
Yeah, nice to see you again here. You say the president needs to demonstrate actual leadership. How so?
Absolutely. What we've seen so far is just the continuation of the campaign of last year. And the American people in August, what they've said is that they're concerned and they're fearful and they're angry about the amount of intervention, potential intervention of the federal government into very personal things like health care. So I believe what the president needs to do is to corral his own troops, get the speaker in line and say, look, we need to work in a positive, bipartisan way because there's a central majority within the House that could pass positive reforms in the health care arena.
But what you're saying he hasn't led. If you would change that strategy, what would you do? We've heard from some Democratic strategists who say, you know, you don't need another speech. What you need to do is lock yourself inside the White House, bring both sides together, and hammer out a deal.
Well, we don't need another speech. That's correct. What we do is we need a new plan. And the plan needs to embrace fundamental American principles, which haven't been embraced in the plan that the president has supported to date. There's no reason that the federal government ought to be making personal medical decisions for patients and their families. There's no reason that the government ought to dictate to individuals what kind of insurance they must have. And there's no reason that the federal government ought to be running a health care plan that will force individuals onto it. But there are positive ways. H.R. 3400, a bill that we have proposed and have more sponsors on that bill than on the president's bill in the House, would make certain that we get folks insured, that we leave decisions between patients and families and their doctors, that we accomplish important things like lawsuit abuse reform that aren't covered in any of the Democrat plans.
That's a compromise you're referring to, and there are a lot of reports out already today that suggest that, well, there's a compromise in the works. Let me get that in a moment here, but I first want to ask you about this misinformation campaign. You know, Democrats would accuse Republicans over the past 5 or 6 weeks of leading that misinformation. Why do you turn it around against the White House?
Well, all of this started with the White House and the Democrats in Congress, starting with Speaker Pelosi, mischaracterizing their own bill. The president has said over and over, if you like your plan, you can keep it. In fact, that's not what the bill says. He says that the government won't be making medical decisions. In fact, that's not what the bill says. He says that it doesn't have anything to do with the treating of individuals who are here illegally. That's not what the bill says. So on and on and on. And the American people got wise to it in August. And that's why you had the outpouring of emotion and passion and concern of the American people.
Yeah, how does the White House reach a deal? I mean, I see the president in a really tricky spot here. You know, Nancy Pelosi has said if you take that government-run health care option off the table, you're not going to get the support from the liberal side of your party in the House. I guess if you keep it in, you're not going to get the support on the Senate side. So where do you get a deal?
He's in a real bind. What he needs to do, and what the Speaker ought to do, is to lead by bringing folks together. As I said earlier, there is a central bipartisan majority in the House of Representatives that's moderate to conservative that will pass an appropriate bill that will truly solve the problems that we have. H.R. 3400 is the bill that we put on the floor. I'm not wedded to that bill, but there are positive solutions in there that will solve the problem of portability. You ought to be able to keep your insurance if you change your job or you lose your job. It'll solve the problem of pre-existing injuries and illnesses so that you don't get priced out of the market. There are wonderful things that we can do, but none of them involve having the federal government take over health care.
You just mentioned 2 ideas in that compromise that I was going to get to. I had 2 more to that list. This is what's being talked about. Keep it deficit neutral and make it easier for small businesses to band together and buy insurance for their employees. That would be 4 things on the table. Would that be enough to get it done?
Sure. Those are fixing the failings within our current system, which is what we ought to do. We ought not throw away the quality that we currently have. Budget neutral is important, though, because if it's budget neutral by raising taxes or slashing Medicare, then those are unacceptable ways to start. We don't need to increase taxes, we don't need to punish small businesses, and we don't need to cut Medicare in order to find the resources to be able to solve this challenge.
Tom Price, you know this very well. You practiced orthopedic surgery for 20 years before going to Congress. I appreciate your input today. Tom Price, out of Atlanta.
Thank you so much, Bill.
You got it.